My name is Dr. J.K.A. Jameel. I'm a senior consultant in the Department of Surgical Gastroenterology and Minimal Access Surgery at Apollo Hospitals in Greaves Road. Hernias happen because of an inherent defect in the abdominal wall or because of a rupture or a tear in the abdominal wall, resulting in a gap through which the contents of the abdominal cavity protrude. The most common symptom that patient has when he develops a hernia is a lump. He often comes to the doctor complaining of a lump. In addition to that, he or she could also have a dragging sensation or occasionally pain, particularly when they are standing for a long time or straining or exerting themselves. And this lump typically gets bigger when they strain, and it gets smaller or sometimes completely goes away as soon as the patient relaxes or goes into the lying position. Now, these are some of the symptoms. There are also patients who remain entirely symptom-free. We call them as asymptomatic hernias. And the kind of treatment that these kind of patients with asymptomatic hernias require is something that needs to be decided after a full and a frank discussion with the doctor. But if they are symptomatic, they definitely require treatment.